Okay, so here we're going to be discussing Horner syndrome, which is categorized by the triad ptosis, meiosis, and hydrosis. Ptosis is slight drooping of the eyelid. In specific is the superior tarsal muscle. Anhidrosis is the absence of sweating and flushing on the affected side of the face. Meiosis is pupil constriction. It can be associated with Pancoast tumor, Brown-Séquard syndrome, which is cord hemisection, and late-stage syringomyelia. Differential diagnosis for ptosis includes the following four, along with many more not listed in this presentation. Number 1, Bell's palsy, aka idiopathic facial paralysis, which involves the craniofacial nerve, not the characteristic sympathetic seen with Horner syndrome. Number 2, chalazion, which is a hard and painless lid nodule due to inflammation of the eyelid. Number 3, Lyme disease, aka borreliosis, where the patient will be seen with fatigue, bullseye rash on the skin, and flu-like symptoms. And lastly, oculomotor nerve palsy. The patient will have a down and out eye on the affected side, along with possible diplopia. Moving on to multiple sclerosis triad, it is also called the Charcot classic triad of MS. The mnemonic is SIN, SIN. Basically, a patient comes in with scanning speech, intention tremor. They may also present with incontinence and internuclear ophthalmoplegia and nystagmus. Multiple sclerosis is actually an autoimmune inflammation and demyelination of the CNS. So patients can present with sudden vision loss. They can also have hemiparesis, hemisensory symptoms, bladder and bowel incontinence. They may also present with heat sensitivity. The main thing to remember are findings of oligoclonal bands, which are diagnostic. Okay, there is a depletion of oligodendrocytes in these patients. Next is a triad for ascending cholangitis, which is also called acute cholangitis or simply cholangitis. It is basically an infection of the bile duct, usually caused by bacteria. It could be ascending from the junction or the duodenum, and it can also be a result of an obstruction by gallstones. The triad consists of jaundice, fever, and right upper quadrant pain. This triad is also called Charcot's triad, just like the MS triad, because it was discovered incidentally by the same person. Raynaud's pentat consists of Charcot's triad for ascending cholangitis plus CNS symptoms such as confusion along with hypotension. It is indicative of a serious biliary infection. Beck's triad of the heart indicates cardiac tamponade. It presents with distended neck veins, muffled heart sounds, and hypotension. Now, the main reason for these symptoms is the physiological fall in arterial blood pressure, which actually results in pericardial fluid accumulation. So, the heart sounds are reduced because of the excess fluid buildup in the pericardial sac. Also, there is reduced diastolic filling of the right ventricle because of the excess pressure in the sac, which causes the jugular veins to be distended. Note, in severe hypovolemia, the neck veins may not be distended. MEG syndrome is classified by ascites, right-sided pleural effusion, and benign ovarian tumor. Please note, ovarian fibromas constitute the majority of the benign tumors seen in MEG syndrome. However, this is a syndrome diagnosis of exclusion only after ovarian carcinoma is ruled out in the patient. Carcinoid syndrome occurs when a rare cancerous tumor called carcinoid tumor secretes certain chemicals in the bloodstream of a patient. Most commonly, this tumor is found in the GI tract or the lungs, and the patient will present with flushing, watery diarrhea, and a valvular right-sided heart lesion. Cushing's triad is a sign of increased intracranial pressure, and the patient will present with hypertension, bradycardia, and respiratory depression. A widening of pulse pressure, which is an increase in the difference between the systolic and diastolic pressure over time, may also be seen. This triad is highly suggestive of a cerebral hemorrhage in the setting of a trauma or a space-occupying lesion such as a tumor in the brain. It can also be suggestive of possible impending fatal herniation of the brain. Plummer-Vinson syndrome is associated with post-cricoid dysphagia, upper esophageal webs, and iron deficiency anemia. So dysphagia, anemia, and glossitis can be seen as a triad, and the patients may also present with choking spells due to the proximal location of the web, along with aspiration. Weakness and fatigue, along with dyspnea, can also be seen due to iron deficiency anemia.